The AATT is a randomized study of the GLA and of the LISA groups. And this study aimed to improve event-free survival in peripheral T-cell lymphoma by 25%. And 104 patients have been included in the trial between 11 and 14 before the study had been prematurely interrupted after the interim analysis. So we present here in Lugano the final results of the AATT trial. And the patient received 4 courses of CHOEP, followed by one course of DHAP before either allogeneic transplantation or autologous transplantation as per randomization. And there is no difference both in event-free survival, which is around 40%, and no difference between overall survival, which is before around 60 and 70%. When you look at the patients who have been actually transplanted, there is a difference, but which is not significantly, statistically significant, favoring the role of allogeneic transplantation compared to autologous transplantation. There is an equivalent number of deaths in both arms, and there is almost all deaths in the auto arm are from relapse. Conversely, almost all deaths in the allo arm are from toxicity. One important thing of this study is to again show that 30% of the population of these patients were in relapse before any kind of consolidation. So the message of this study is that we need to have more accurate prognostic indicator of primary progression. We need to improve the induction chemotherapy, induction treatment of peripheral T-cell lymphoma. But we also show that while it's toxic, allogeneic transplantation is an efficient prevention of relapse as a consolidation in peripheral T-cell lymphoma. But the toxicity rate will counterbalance the improvement in the limitation of relapse. At the moment, further study will not include allogeneic transplantation frontline as a consolidation treatment of peripheral lymphoma. But we will move and work on the improvement of both induction and prevention of early relapse. We also think that the message is once you have a peripheral T-cell lymphoma, which is in relapse, it's important, if the patient is eligible, to think about allogeneic transplantation.